Many patients will have an episode of urticaria at some point in their life. Generally, this is self-limited, treatable, and passes fairly quickly. However, there are times that patients have urticaria that goes on for 6 weeks or longer. There's no identifiable cause, and this is when we call it chronic idiopathic urticaria. If we suspect a patient has chronic idiopathic urticaria, we ask them questions about their lesions and about their duration. So one important characteristic of urticaria is that they tend to come and last only for about 24 hours or less. So if a patient has what look like urticarial lesions, but they're fixed, they're there for days or weeks, and particularly if they are healing with bruising, then we need to think about possible other diagnoses. Really, the one main diagnosis that we want to exclude is urticarial vasculitis. So urticarial vasculitis can appear like urticaria, but it tends to be fixed. It lasts longer than 24 hours and heals with bruising. This can be associated with autoimmune diseases, specifically lupus. So if we suspect this, then we will perform a skin biopsy to verify that diagnosis. There are different degrees of severity. So some patients may have only a few lesions. Some patients will have 50 to 100 lesions. This is particularly difficult. There are patients who can get lip swelling with this, which is particularly bothersome. In general, there's not airway compromise with urticaria. Interestingly, we very rarely find a cause, and it really, other than asking basic questions about drug exposure or triggers, we generally don't go looking for a cause because we know that in general, we're not going to find one. So we really focus on symptomatic treatment. The first line of treatment for chronic idiopathic urticaria are antihistamines, and generally not just one antihistamine, but multiple antihistamines at 2 to 3 times the over-the-counter dosing. And so we will often put patients on 2 to 3 non-sedating antihistamines, dosed usually about twice a day. And then in addition, at bedtime, we'll add a sedating antihistamine. If this is not sufficient to control the urticaria and we need to add something else, then we start looking at additional therapies. There's nothing contagious about urticaria, either acute or chronic idiopathic urticaria. So patients often ask that question, and we reassure them that in fact they can't pass this to anybody.